Hi, my name is William Flannery. I'm an ENT consultant at the Royal Berkshire Hospital in Reading, and I am lead for paediatric ENT. I'm passionate about childhood deafness and was very excited to take up this post in 2000. Prior to this, I was clinical fellow at Great Ormond Street Hospital in the ENT department. One of the exciting things about coming here was integrating with the multidisciplinary team. ENT didn't have much of a history of multidisciplinary working in paediatrics when I came here, and I immediately set about re-establishing relations with the paediatricians, building relationships with the audiologists and speech and language therapists. Also in our multidisciplinary team we have a wider team that include the Sensory Consortium Service, who have peripatetic teachers of the deaf within their system, educational audiologists and other support workers. The most important thing in my mind about multidisciplinary working is that there shouldn't be any professional jealousies. It's very important that those barriers are broken down and that we work closely together to achieve the final goal, which is to help children. I think one of the biggest barriers to multidisciplinary working is the idea of lines of demarcation and who does what, and I don't think that's particularly helpful. We work very well here at Reading, particularly between ENT, audiology and speech and language, because we are co-located. And the challenge then is to make sure that we integrate with the wider team. And the way we do that is through our Children Hearing Services Working Group, the CHISWIG. When I first started, I chaired what was to become that, and we just had 2 or 3 people turn up to the meeting, and it was very under-attended and we really couldn't achieve very much. Now I'm glad to report that over the intervening years the CHISWIG has been seen by healthcare professionals as an important forum for the delivery of services for children with deafness, and we now have regular attendances of over 20. The multidisciplinary team is very popular with patients and parents. They like a one-stop shop, they like joined up healthcare provision, and so we take great care to make sure that what we tell the parents is coherent across the three main specialties within the Royal Berks Hospital. We then have a duty to convey that to the wider network to make sure that the management of the patients is coherent throughout. This is very difficult. I wouldn't like to pretend that it's multidisciplinary working is easy. It's extraordinarily difficult, and though it benefits the parents and patients, it is quite a strain in terms of operations and also finance to provide a multidisciplinary service. The operation side is quite complex, and a child coming to see us in one of our multidisciplinary clinics will see 3 specialties in one visit, and we need to manage that because the parents particularly get quite frustrated by the amount of time there is between seeing each healthcare professional. I don't think we were particularly good at that in the past, at managing that, but we're on a drive at the moment to try and manage patient expectation, parent expectation, so that their journey through our department is a fruitful one.